We were actually waiting for you, but I don't know whether you want to go around first.
National Suzo? Monday, sorry. Cewa ta mai kashe mota Usman yawa ta mai kashe mota na mana ya fitar da mota wurin da kuma baya mana
Oh, okay. Yes.
You know.
Hello. Another laboratory work. We just put them around. We are trying to wind down. Yes, but they are still working. Because we have a lot of people who are doing surgery. And we need blood. We need one thing. That's why they are all hanging around. So, thank you very much. I've come down to express my appreciation to you all for the contribution you have made to the success of this program. Everybody has put his hands on the deck to ensure that this outreach has run successfully. So I want to appreciate you. Thank you. Because what you have done cannot be measured, cannot be quantified, but the people that have benefited from your services will be eternally grateful for your help and your assistance. So thank you very much. So just for record purposes, maybe just
the view of everybody.
Okay, thank you. Thank you. Some of the doctors were consulting
vision for the success of this program. We really say thank you for everything you have done. And we say, we know the environment is not conducive, but we have not had any confidence. God bless you. And we hope that next time we have another course, call on you to come and help us.
Actually, today we didn't get this.
tana barci. Yeah, very much. Before you scare people. Can we take pictures? Here. Right here. Hi, you guys. Okay. I think walking in there with yeah. Just walk in. You can go in. I'm here, sir. The city will send it over. My own thank you, sir. Protocol was down.
You don't snap people.
Tiba-tiba bintang kan dekat arbola. Tiba-tiba bintang munggo de sekai. Ale dada. Bisa munggo de.
Right here.
Allah yana gaba kana bayan shi.
Amma me sunan ki?
Suna na Rose Biyaya
Daga ina?
daga cikin Mayo-Belwa.
Za mu san masalan da kake asibiti.
Kai matsala mun zo da mai gidana shi yana da matsalan ido ni kuma ina da matsalan hakori.
Kun samu kun ga likita?
Mun samu mun ga likita.
To me ya baku?
An yi ma mai gidana aiki a idon shi.
Ke kuma fa?
An cire min hakori wanda ya ba mu wahala tun shekaru da dama.
Na shekaru nawa ne wannan hakorin ke damun ki?
Shekara 3.
Me yasa bake samu kin je asibiti ba?
Na je asibiti in an bani bil ban da kudi sai in dawo.
Sai ki dawo. Shi ne kidan ki fa me yasa bai je asibiti?
Shi ma mun je asibiti kafa biyu mun je maganan kudi ne ya hana muka dawo.
Kaman kudi kiman nawa?
To ni ce mai suna Rose Biyaya daga Mayo-Belwa. To muna da damuwa mai gidana yana da problem na ido ni kuma problem na wani hakori. Mun je asibiti so biyu ba mu iya mun samu an yi mana aiki ba bisa ga rashin kudi, amma da Allah ya sa Senator Binos ya kawo mana hanya na samun sauki. Ubangijin Allah ya sa an yi ma mai gida na aiki a ido kyauta, ni kuma an cire min hakori na an bani magani kyauta. Mu ba abin da za mu iya ce ma Senator Binos, Ubangijin Allah shine zai biya mishi bukata duka. Mu kuma mun gode masa sosai. Ku masu aiki kuma Ubangijin Allah ya sare ya fitar muku da gajiya. Godiyanmu mara iyaka, ba abin da za mu iya ce mishi. Don in ba wannan sanadin da ya zo da shi ba, shekaru kusan 2 zuwa 3 muna fama da wannan damuwa da mai gidana, to ba mu iya samu kuɗi mu yi aiki duka biyu ba. Amma wannan program da Senator Binos ya kawo ya sa yau mai gidana ya samu sauki, an yi mishi aiki, ni kuma hakori na an cire wanda yake damu na an bani magani. Muna ce masa mun gode, mun gode. Ubangijin Allah ya saka mishi, Ubangijin Allah kuma ya sare shi a duk aikin da yake yi. Fatanmu ne ya zauna wuri shekaru da dama ba ninki mu talakawa muna masa godiya sosai. Na gode, na gode.
I'm Dr. Peter Paul Kwaspo, the Principal Medical Officer in charge of this facility, Cottage Hospital, Mayo-Belwa.
So can you tell us the situation of things during this course of medical outreach?
Yeah, actually, we're really happy for this program because since I came to this place, there has never been such a program like this. We want to say thank you to the senator, distinguished senator, for actually taking out his time and resources and the kind of people he brought to this very facility. Truly, we're really happy, because if you can see now, if you go outside, the kind of crowd that we have here, it's actually amazing. I think by now we must have seen more than 2,000 patients, and then different kind of illnesses. We have those that have eye problems, which they came and they were operated upon. Program is still going on. Those with medical conditions, all kinds of medical conditions being attended to, and even basic general surgeries and gynecological cases all being attended to. So for the past days, in fact, the normal hospital activities has been grounded because everything is free. Drugs are free, treatment is free, consultation free, everything is free. And I'm sure everybody is happy with what is going on currently in Mayo-Belwa. And it's not just people from Mayo-Belwa that have been attended to, because I'm sure people from the neighboring local governments also came for this outreach to benefit from what the distinguished senator is doing.
So what are your challenges?
Basically, so far, it's just the crowd control. It's not easy when you have such number of people. Everybody wants to access the healthcare, but the traffic is much. Controlling the people, it's not actually easy, but we are trying our best, because we reassure them if they are patient enough, and then everybody is going to have access. Everybody is going to be attended to.
So what are the advice that you can give the distinguished Senator Binos Yaroe?
my words of advice is that he should keep on doing the good work, because truly health is wealth. When you take care of the sick, there is much to it. Blessings will follow you, and then his people, because there are some that are actually less privileged. They don't really have the money. Some have been carrying these ailments for a long time because of financial constraints. They could not come to the hospital. So I think he should continue to put more priority to health as he has started. He should not get tired. He should not relent. He should keep it up. It's really beneficial to the community and to everybody at large.
I'm Dr. Talemo Wiklifda. I'm Director of Soteria Africa Rural Healthcare Initiative, the indigenous non-governmental organization that is taking care of the, is effecting and implementing the outreaches.
So, sir, I'm sure you have come across so different kinds of diseases because of this work.
That's right.
Which of these are prevalent as you go on with this work?
On the things that, on a general note, I want to think the illnesses that are peculiar to the eye are most prevalent, and that is not peculiar to just this place. All the places we've been, the illnesses that are peculiar to the eye are the most prevalent. But the other ones that are common are the ones you expect of farmers. People have hernias, they work themselves out. People have ulcers, people have hypertension. That's in addition to infections like malaria. Those are the very common ones.
So before you tell us the number of people that you have worked on or operated on, what will you say is responsible for this high prevalence of eye problems?
I wish I knew, because I have noted it with the ophthalmologists and the optometrists. They are finding it difficult to know, and I'm trying to see how we can investigate and see what is responsible. But it's so common that I was advocating to the senator that at the end of the day, when we are done with the local governments, we may have to do one that is just peculiar to those eye problems. But it's difficult to know what exactly is the problem. We can arrogate it to weather, but we share weather with many other people also. You can allocate it to maybe the economic situation, but that is a common thing and cannot be localized here. So it's difficult.
So how many people have been treated that you are treating?
We have seen so far over 5,000 people. And I have some statistics here of the various things that have been done. The people whom the eye section that I talked about, 600 cases have been seen. Out of those, about 179 eye surgeries have been done. In the last 4 days. Successful. Okay, maybe one of those times you come to the what we call opening ceremony, when their eyes can't see and they are done surgery the next day. They open it after the surgery and they see and they start dancing. About 402 lenses have been distributed, but the total people seen were about 600 in the eye department. There are about 309 surgeries done so far. That is in the general surgery, but you saw the people lining up. There are about 30 or 40. We are hoping to get them done tonight and perhaps tomorrow morning, some of them. So I think the number is going to be much more. Like I said, we repaired hernias, did appendices, and did exploratory laparotomies, biopsies, hydrocele, fibroids, hysterectomies, and so on. Those were the surgeries that were done. The laboratory support helped us. We have we have 2,296 people who are tested in the laboratories, which means because some of them have 5 tests, which means we will have done more than 1,000 tests carried out. There was a dental department that attended to 408 people. They scaled, they polished, they extracted teeth and treated as appropriate. And then I don't have the figure of those who had counseling for the various problems that they had. So that's what we had so far.
Number of doctors that are involved in this?
About 55 people came from outside this place. Yes, but no, medical workers. Yes, doctors are about 25, but other medical workers took also, and they joined hands with everybody here. If you ask me my total number of volunteers, I estimated for 250, but I know it's more than that because by the time I serve lunch, a few complained that they did not get, which means that I have more than 250 people volunteering. And that is what the Senator was emphasizing, that is a kind of a collaborative effort which were powered by him so that everybody had contributed. If not, we would not have achieved what we did achieve.
Any difficult cases? And if there are any referrals?
We had some, the second day we had some 2 road traffic accidents that were from different sources and they were brought in. The first set were attended to here and admitted. We saw some of them. The second set, some of them were attended to and some of them had first aid, and so the Senator provided an ambulance. After the first aid, they were referred to the Federal Medical Center, Yola. Talemo Wycliffe Da, consultant obstetrician and gynecologist and a public health expert.
Thank you very much.
Thank you.
For the record purposes, your full name, sir?
Well, my name is Senator Binos Yaroe. I'm a senator representing Adamawa South in the National Assembly.
What is the purpose behind this outreach today?
Well, I'm surprised this question keeps coming up. But the purpose is basic, is essentially to help my constituents with their health challenges. We know that health is number one, health is wealth. Without somebody being in good health, he will not be able to do any other thing. So I thought that one area where I can intervene to help people at the grassroots, at the local level, is to bring medical services to their doorsteps. That is why we have done this, and today we are concluding the 4th outreach that we have packaged for our people. So the purpose is, yes.
Senator of the Federal Republic of Nigeria, how would you describe the issue of health in this country? What's your thoughts on it?
Everybody knows that we don't have very, very good health services in the country. We know we have at various levels of government, various health facilities, but you go to a lot of even primary health centers, dispensaries, cottage hospital like this one. There are so many things that are lacking, and some of the people come, they are not able to pay for the basic services that they require, and some of the drugs that they need, they are not able to get them. So, you know, I remember maybe somebody said way back in maybe 1993 that our hospitals and our clinics have become mere consulting rooms. So what was said at that time still persists today. So we are lacking in good health services, and we know government is trying, but there's a lot that needs to be done. So, and that is why I took it upon myself to be able to intervene in the little way that I can to bring a difference in the lives of people.
So how many people were treated and how many cases were prominent?
Well, like I said, I will not be able to give you the figures because I don't have them. But the coordinator of the program, Dr. Da, will be able to do that when you ask him.
Distinguished Senator, sir, you started this program since last year, and we believe over 10,000 people have benefited from it. In terms of finances, how much have you spent so far for these humanitarian services?
If I start thinking about how much I've spent, I may not be able to do it. You see, it is not how much I spend that is important, but it is the impact that we are able to make. You know, because the doctors, the nurses, the lab technicians, all the people involved in this that we have brought from all over the country are offering their services for free. You can't quantify that. You say we have treated 10,000 people. We have treated, in my own estimation, more than 20,000 people. Because in Demsa, we treated over 8,000 people. In Ghana, we treated over 5,000 people. In Gui, we treated over 3,000 people. And so far, the information I have is that we have done more than 5,000 people here. So if you tally all those figures, it's something over 21,000. So that is what we are doing. It is, if somebody gets help, whether the cost is 500 naira or it is 10,000 naira, it doesn't matter. The important thing is that those people that needed help have been able to get it for free.
Sir, what call will you make to the federal government? Now you have been on ground, you are someone serving in the health sector. Going forward, what help call will you make to the federal government to see that our health facilities improve upon our healthcare services improve upon?
You see, the problem we have in this country is having our priorities right. If you just go back into the 2020 budget or the 2021 budget, you'll find that the budget is skewed towards consumption. I've said it a number of times. When I was commenting on the 2020 budget, I said it, that the budgets that we do in this country, we do more of a budget of consumption. If you are having a budget of 13 trillion naira, and out of it, it is only 4 trillion naira that is going for capital, then you know that you are not going to make progress. So what I would call the government or the federal government to do is to reorder its priority, and do those things that will make the largest impact on people. Like I said, health is number one. Health is wealth. So, more appropriation should be given to the area of health to improve our health facilities, to get the equipment that we require to attend to people, to get our people that are trained to deliver the services, and to encourage them to stay back in Nigeria and work. A lot of our doctors go outside the country because the environment, the conducive environment for them to operate is not available. So they go to United Arab Emirates, they go to US, they go to UK, But if we have facilities, we train first-class people in this country, but we don't give them facilities to work with. We allow them to go outside the country. So my call to government is to give priority in this area, to allocate more resources to this area, to encourage our health professionals to stay back and work in this country.
And distinguished senators, away from health issues, recently there was a comment that was attributed to you concerning the Fulanis. I think this is an opportunity for us to really hear from you. What is it all about?
Well, I would not want to this program that we are doing, I wouldn't want us to steer away from the purpose we are here. We are here to attend to the health needs of our people. No distinction as to religion or tribe or political affiliation or ethnicity or anything. People that come here to be attended to are people of all faiths,
There are people that are idol worshippers that have come here and they have got help. Muslims have come here, they have got help. Christians have come here, they have got help. You know, people of all ethnicities have come here and they have got help. And the comment I made in the Senate is a comment that came out of my concern for what is happening in this country, and especially what is happening in my local government. I can stay here and narrate to you the number of people that have been kidnapped in this local government, and those people, after they have paid ransom and they have returned, the testimony they have given as to who were responsible for their kidnap. It is not a secret, it is an open knowledge, we know. And the problem we have in this country is we don't want to hear the truth. You know, if somebody tells you the truth, you don't like him because what he's saying, you don't want to hear it. So you demonize him. What I said on the floor of the Senate is the absolute truth, is the gospel truth. I did not say anything that is not true. So, you know, if people are vilifying me because I've said the truth, and I've said that the people that are sponsoring these people that are causing this problem should stop. That is my call. What is wrong with that? You know? So that is it. But let's leave that apart. Let's concentrate on why we are here. We are here to attend to our people. And I am pleased that we have done that you have seen us walk around the world, you know, and I feel embarrassed when people start hailing me and start, you know, that is not. The important thing is for us to help our people, irrespective of where they come from or who they are. And we have successfully done that.
Yes, sir. Senator, sir, in the course of doing this, you must have got a lot of support from individuals and organizations. Is that true? That you have got?
Absolutely, absolutely. I couldn't have done this on my own. You know, the only thing I've done, as I keep saying, is to provide a little, logistics to allow this to happen. Like I said, the number one support we have got is these doctors, these nurses, these pharmacists, all these professionals, and even the cleaners and everybody that is working here that have come from different places. Some people have come from Jalingo, Taraba State. Some people have come from Abuja. Some people have come from Jos, from Lafia, from Makodi, you know, from Yola, from Numan. They have all come here and they have stayed here since Monday. Some of them arrived on Sunday. They have been here since that time. No good accommodation, no good feeding, nothing good. But they have stayed here, they have worked their hearts out, and they have done a lot for our people. I am eternally grateful to them.
Okay, sir, let me take you on this. You just talked, you showed so much concern on health. And as a senator, how much effort have you put so that this kind of services can also be replicated somewhere, not by you, by your colleagues, so that health facilities, which is wet, should get down to the downtrodden?
You see, people have their priorities. Some of my colleagues or some politicians, what they believe in is when they come home like this, they come with change money, and come with money and go around and be distributing money to people. That is their priority. You know, some departments, some parts of government, they feel empowerment. When they talk about empowerment, they reduce it to calling people and giving them 20,000 naira, giving them 30,000 naira, and they say they are empowering people. You know, so everybody has his priorities. And like I said, my own priority, number one, is health. I don't have the resources to go and construct clinics or health centers across the 9 local governments. I don't have the facilities or the resources to directly put facilities and equipment on the ground. But what I can do and what I'm doing is to get people who are willing to come and intervene directly as we are doing. You know, so that is that is what I'm doing. You know, my colleagues, there are some of my colleagues that also do medical outreaches, you know, and there are some that when they see this one, they become excited. They say, we also want to do it. But at the end of the day, they look at it and they think that that is not important. There's something more important than that. But to me, I said there's nothing more important than health. You're welcome. Thank you.